A warm welcome. I would like to speak about our experience we have, how we can help nurses to foster their abilities in family interviewing skills. So I just would like to introduce myself. My name is Barbara Preusse-Bleuler, and I'm working in two areas. I'm working at the University for Applied Science of Zurich in Winterthur, Switzerland, and there I'm working as a lecturer on the faculty. And I have another area where I'm working in the praxis, where I'm helping nursing teams to implement family nursing into their daily practice. Also, I'm speaking here on my own. Just imagine that all my colleagues from the praxis would be here as well, because all this work of development we are doing together. And well, in Switzerland, up to now we have several teams which introduced family nursing to their daily work, to their daily practice, mainly based on the Calgary Family Model. So we have experience going up to 13 years now, and those are wards or unit teams of nursing in different sites. So we have it in hospital, we have it in community nursing, we have it with children, we have it with adults, we have it with oncology patients, with critical ill patients, in a great variety of settings. Well, right from the beginning, when we started with these implementations, we wanted to ensure sustainability. And I think we managed quite well. So we developed concepts for teaching nursing in practice, we developed context for following up, we developed teaching materials, we had a handbook which is very useful. And we have, which is very important, in each institution, on each ward where we do family nursing, we always have a core group of nurses who really goes for family nursing and who has additional education and who serves as clinical facilitator for their teams, for their colleagues in family nursing. Well, also, although we have quite good reports and nurses being satisfied using this model in their daily practice. But nevertheless, we have some ongoing rumors. So we had to look at our core teams, which really tried to resolve those problems, but they sort of got stuck, and the risk was that they were demotivated too much. So we tried to look at these problems, and we tried to learn how we can resolve these. Well, looking at those problems, we decided to engage in an action learning process in order to capture those problems and to find a solution. So we saw that we do have to do some redefinitions to face those concerns which keep arising. Well, this action learning process was very interesting and brought us a lot of insights. And one of the output was that we developed a self-teaching and self-evaluating instrument for family nursing assessment, so that the nurses can conduct themselves and look at their competences and look how and what they still can develop. And we embedded this self-teaching and self-evaluating instrument, we embedded it in a peer-to-peer counseling process. So what we suggested to the nurses, that they work shadowing each other, that they go to each other and watch the family assessment so that they can learn from each other and discuss their competences. So we evaluated this process as well, and we saw that this instrument combined with a peer-to-peer shadowing really helped the nurses to develop their competences. And finally, we heard much less rumor about the difficulties of doing family nurses. But what we heard and what we learned, that now the nurses that, now we learn how to use the genogram and EcoMap, and when we know how to use it, we start to have a direct relationship with the family, and we are much more attentive to the priorities the family sets. And if we can do this, we really find together a thread and pull in the same direction.